Assalamualaikum warahmatullahi wabarakatuh. First of all, let me introduce myself. I'm Raissa Anandhianya Dikna as a presenter from Faculty of Medicine of Jenderal Ahmadiyya University. Today, I will explain about COVID-19 incidence and severity in pregnant women at Cimahi Referral Hospital by Dr. Fasihah, Dr. Asti Kristianti, and Raissa Anandhianya Dikna. Coronavirus disease or COVID-19 is a highly infectious and pathogenic disease caused by severe acute respiratory syndrome coronavirus 2 or SARS-CoV-2, which is causing a worldwide pandemic. For the severity, COVID-19 divided into asymptomatic or without symptom, mild or with symptoms, oxygen saturation more than 95%, respiratory rate 12 until 20 per minute, without symptoms of viral pneumonia or hypoxia, moderate or with signs of pneumonia such as fever, cough, dyspnea, and rapid breathing, but no signs of severe pneumonia, oxygen saturation less than 95%, and respiratory rate 12 until 30 per minute. Severe or with signs of pneumonia and plus 1 off, respiratory rate more than 30 per minute, severe respiratory distress, or oxygen saturation less than 93% in the room air. Critical or ARDS with acute respiratory distress, sepsis, and septic shock. The virus causes many symptoms. There are fever, cough, anorexia, fatigue, myalgia, out of breath, sore throat, headache, diarrhea, nasal congestion, anosmia, algesia, nausea, and vomiting, conjunctivitis, skin rash, shivering, loss of appetite, irritable, chest pain, confusion, seizures, loss of consciousness, nervous, depression, sleep disorder, stroke, encephalitis, delirium, and nerve damage. COVID-19 in pregnant women in Indonesia from April 2020 until April 2021, there are 536 cases. There are physiological changes in the immune systems during pregnancy, so pregnant women are more susceptible to experiencing more severe condition due to respiratory viruses. For the methods, we use the descriptive method taken by total sampling using the secondary data in medical records of pregnant women who have confirmed COVID-19 at Dustira and Cibabat Hospital. Patients who are confirmed to have COVID-19 with asymptomatic or mild symptoms are sent home to self-isolate, and we got their data from Cimahi Health Department. For the research variable, there are maternal age, parity, gestational age, comorbid factors, severity, and clinical symptoms. For the result, we obtained 129 medical records from December 2020 to July 2021. There are 81 patients from Dustira and also 48 patients from Cibabat Hospital. For the maternal age, most of them were 20 until 35 years old, or 79.07%. 20 until 35 years old are the ideal age for women to get pregnant. And pregnancies at less than 20 years old and more than 35 years old are one of the high-risk pregnancies. So it is very likely that the majority of pregnant women patients are 20 until 35 years old. For the parity, most of them were multiparous, or 62.02%. Multiparous is defined as a woman who has given birth to 2 or more babies who are able to live. So the majority of pregnant women in Dustira and also in Cibabat are multiparous. However, there hasn't been a significant relationship between parity and COVID-19. For the gestational age, most of them entering the 3rd semester, or 82.95%. There is a fluctuating immunomodulation during pregnancy, especially the pro-inflammatory state during the 1st and the 3rd trimester. So at that trimester, pregnant women are more susceptible to having heavier severity. For the comorbid factors, 30 of 129 patients had comorbidities. 5 patients had more than one comorbidity. The most common comorbid factors are hypertension, or 14.73% patients had hypertension. Hypertension was the strongest risk factor for increasing the severity of COVID-19 because the number of the ACE2 receptor was found to be relatively higher in patients with hypertension that caused the virus disseminating in the body more easily. For the symptoms, 120 out of 129 patients had more than one symptoms, and the most common clinical symptoms are cough. Or there are 86.8% patients had cough. Cough is a reflex that acts as a part of the body's defense system to protect itself from pathogens or foreign objects. The most common cause of cough in adults is viral upper respiratory tract infection, including COVID-19. For the severity, most of them had a moderate symptom, or 73.64%. The discussion, there are differences about the severity with previous study, which states that majority of pregnant woman patients have no symptoms or asymptomatic. It can be caused by, in these studies, the majority of samples were from Dustira Hospital, which is the referral hospital for the management of certain emerging infectious disease by the Indonesian Ministry of Health based on the decree of the Minister of Health of the Republic of Indonesia, number HK.01.07/Menkes/169/2020. There is an incomplete pathogenesis and pathophysiology of COVID-19 related to pregnancy, so the further research on COVID-19 in pregnancy is needed. For the conclusion, characteristics of pregnant women with confirmed COVID-19 at Dustira Hospital and Cibabat Hospital, most of them age 20 until 35 years, or 79.07%. Multiparous, or 62.02%, entering the third semester, or 82.95%, and the most common comorbid was hypertension, or 14.73%. The most common clinical symptom was cough, or 86.8%, and the most common severity was moderate symptom, or 73.64%. That's all my presentation today. Thank you for your attention. Wassalamualaikum warahmatullahi wabarakatuh.